Good afternoon, everyone, and thank you for joining us today. Today, we recognize Heart Failure Awareness Week, a nationwide campaign to bring awareness to the risk factors, signs, symptoms, and treatment of heart failure. The theme for Heart Failure Awareness Week this year is Heart Success, Function, Not Failure. The goal of today's webinar is to empower patients to take control of their heart health. Having heart failure does not mean that you need to stop doing all of your normal activities and enjoying life. Making changes to your lifestyle and taking an active part in your treatment plan will help you improve your health and overall quality of life. Patients who report greater levels of improvement and emotional well-being often build new habits around eating better, tracking and managing their symptoms, and exercising, as directed by their healthcare team. Today's webinar, you will hear from heart failure nurse practitioners from across the Mount Sinai Health System who will help share some tips to help you better manage your condition. Remember that understanding and taking control of heart failure is the key to success. So now let me introduce our esteemed panelists. We have Joselle Diaz from Mount Sinai South Nassau, Adeniki Okewu from Mount Sinai Morningside, Kimberly Ennis from Mount Sinai Queens, Jennifer Ullman, Mount Sinai Hospital, and Lena Chang from Mount Sinai Beth Israel and Union Square. So let's get started. The first question, Joselle, is going to go to you. We know that patients can live a long and healthy life with heart failure, but depression is common for many patients and of course can impact their well-being. What are some strategies that patients and their caregivers can take to deal with the emotions of living with heart failure?
Thank you for that great question, Beth. Depression and anxiety are real challenges that affects our heart failure patients and their caregivers. But there are a lot of ways that patients and families can deal with this emotion. First is by establishing a good healthcare provider who will be your point of contact. This could be a nurse, nurse practitioner, or your physicians. This could significantly lessen your anxiety knowing that you have someone to contact whenever there are any issues related to your heart failure diagnosis. Also, for patients and caregivers, make sure to make your heart failure care provider aware if you start to experience any new symptoms such as fatigue, irritability, restlessness, loss of appetite, lack of energy, difficulty concentrating, difficulty sleeping, muscle tension, palpitations, or just an overwhelming fear of the unknown. While some of the symptoms can be related to medication side effects, this could also be an early symptom of depression that needs to be addressed promptly. We also want to remind our patients and families to be aware and avoid non-healthy ways of dealing with these emotions. Avoid cigarette smoking, avoid drinking alcohol, avoid illicit drug use, avoid eating unhealthy food, avoid sedentary lifestyle, and most importantly, do not isolate yourself from your family and your loved ones. We want you to focus on healthier strategies, such as resuming physical activity as soon as you get a clearance from your cardiologist, stay active, participate in outdoor activities like walking, jogging, to get the endorphins going. Focus on your support system, like friends, families, or religion. Engage in social activities like volunteering. Get enough sleep. Try yoga or meditate to help you relax. Talk about your fears, as this will open door for help and information. I've also recommended journaling to some of my patients. Write it out, your challenges, your milestones. It helps you track your progress. Find hobbies that you enjoy. Talk to your healthcare provider and attend a support group. There are now growing communities, both online and in person, for heart failure patients and their families. Continue to communicate with us about your progress. Keep up to date with your treatment options. Utilize your resources as you navigate with lifestyle adjustments. And most importantly, know that heart failure is a lifelong journey and you have us, your healthcare providers, to help you. Thank you.
Thank you, Joselle, for those strategies. Next question is to Nikki. We know that a healthy diet can play a significant role in helping to decrease some of our patients' heart failure symptoms. What modifications should heart failure patients follow, for example, when dining out or also even cooking at home? And really, why do heart failure patients need to limit their sodium?
Beth, this is a great question. I'll start off by discussing why it's important to limit sodium in the diet. And I always tell my patients, wherever salt goes, water goes. So if you're eating too much salt or drinking too much fluid, your body will then hold on to more water, and that will in turn cause your heart to have to work harder. This can worsen your heart failure symptoms and really affect your activity level. And this can be especially frustrating for patients, especially those who enjoy exercising, walking around the park, or even just completing their normal daily activities. So some tips for cooking at home. I always recommend to my patients, throw out the salt shaker. This is going to avoid the temptation of reaching for the salt that is nearby. So just get rid of it in the kitchen or in the pantry. We can be creative by using fresh herbs, spices, garlic, onions, and lemons to really bring out the flavors and tastes of our food. Certain condiments can be very high in salt, such as bouillon cubes, mustard, steak sauce, and soy sauce. And canned and processed foods are a huge culprit. These are foods that I classify as having hidden salt. There are foods such as cheeses, bacon, bologna, hot dogs, turkey, and sausages. Frozen vegetables are a better option, but fresh fruits and vegetables are always the best option. You can substitute white rice for brown rice. You can substitute whole wheat breads and pastas for instead of using white bread and pasta. And oatmeal, those all have such a low sodium content, and I would highly recommend those. And some tips for eating out. We don't want to spoil the pleasure of our patients eating out at restaurants. We want them to enjoy it. We just encourage healthier modifications. So again, I would recommend removing the salt shaker from the table. And when the patients are going out to eat, I want to have you recognize in the menu, the foods that are very high in sodium and try to avoid them. I would recommend you selecting raw vegetables, fresh fruits, rather than salty snacks such as French fries. And really, again, try to limit the condiments, the tartar sauce, the mustard, the pickles, and consider adding extra lettuce, tomatoes, or onions to your meal. Salad dressings are often very high in sodium. So instead of using a salad dressing, you can use a twist of lemon, a splash of vinegar, or if you really do have to use a salad dressing, a light drizzle will do. And a lot of people don't realize that when going out to eat, you can request for the cook to prepare your meal without using salt or MSG.
Thank you, Ed, Nikki, for that tip. That's great. Kim, we know that regular exercise has many benefits for all of us. It's no different than for patients with heart failure. Can you suggest an ideal exercise program, and what are the benefits of regular activity, a regular activity program for heart failure patients?
That's a great question, Beth. So heart failure affects the heart ability to adequately deliver oxygen and blood to the body, and it can cause fatigue, shortness of breath, and low exercise tolerance. Therefore, it's really important to know what is an ideal exercise regimen if you're living with heart failure. I would first suggest for patients to start with shorter exercise sessions, such as 10 to 15 minutes, and then gradually build up to 20, then 40 minutes. Some exercises to consider are aerobic exercises, such as jogging, riding a bike, and low impact water aerobics. Other exercises are strengthening exercises using a resistant band or free weights, but I do recommend don't use weights heavier than 10 pounds. And there's flexibility exercises such as stretching, doing yoga, and Tai Chi. But it's also important to do exercises that you love, such as dancing or gardening. This all helps improve your circulation and boost your heart health. Benefits of exercise programs for heart failure helps to lower your blood pressure, better weight control, strengthen the muscles, also that's your heart muscle, and it can also stop or slow the development of diabetes, lower your stress level, and can also reduce inflammation. It's also very important to discuss your exercise regimen with your cardiologist or your primary care doctor.
Great, thank you, Kim. Jen, we know how important it is for all patients, but particularly our heart failure patients, taking all their heart failure medications is one of the most important things that you can do. Can you share some helpful tips to help manage multiple medications? And what are some of the new medications available to heart failure patients today?
Sure, thank you. And thank you for joining everyone. So, managing your heart health when your heart doesn't function as well as it should can mean that your heart team has prescribed several medications. And this can be overwhelming, but it doesn't have to be. While there are often several medications that you can take, I want you to focus on the Fabulous 4 plus 1. So the Fabulous 4 are first the beta blockers. So you may be on carvedilol or metoprolol, ARNI or ACE inhibitors such as Entresto or sacubitril valsartan or lisinopril, the MRAs, which may be spironolactone or eplerenone, and then the last one, the SGLT2 inhibitor, otherwise known as empagliflozin or Jardiance or dapagliflozin or Farxiga. This is the new kid on the block. Best known previously for their role in managing diabetes, we now have new and strong data to show that regardless of your diabetes status, these medications can improve heart failure and are considered the fourth pillar in the Fabulous 4. Ask your heart team providers if you are on these, and if not, why. There are some contraindications and reasons that you may not be on them, and there are alternatives to consider as well. So discuss that with your heart team. The plus 1 is the diuretic or the water pill. The only reason we take these is to really relieve congestion and excess fluid. And these medications can often vary with dosing and timing, can be a little confusing. So some great ways to keep track of all of this are, one, to make sure you keep track of your, know your dry weight and keep track of your daily weights every day. If you see that weight going up by a couple pounds, make sure you reach out to your heart team right away so that we can make appropriate adjustments. For medications that are often prescribed multiple times a day, schedule them around daily activities such as meal times. Many of you are on beta blockers and Entresto, so take those with breakfast and dinner. Take diuretics or the water pills in the morning. It can help you reduce nighttime frequent urination and help instill compliance for what can otherwise be a very uncomfortable medication. Use a pill organizer to save time as well as improve efficiency and safety. And lastly, always carry a list, either paper or on your phone, of your medications and doses, and don't forget to update it after you see your provider.
Thank you, Jen. Very helpful on taking your weight every day. Yes, absolutely carrying a list of your meds and the pill organizer. Great comments. Lena, this question is for you. We know that being a caregiver for somebody with heart failure can be a long-term commitment, of course, of time and energy. What are some tips or tools and resources for caregivers to look after themselves while also looking after their loved one?
That's a good question, Beth. In our practice at Mount Sinai downtown Union Square, we involve the caregivers of our heart failure patients right at the beginning of the process. We work out every single detail, from follow-up appointments, organizing medications, initiating a daily weight log, providing support groups and resources to enable the caregiver to be well prepared to support this patient. Having a checklist, ensuring that medications are available and covered, clearly labeled pill boxes, and having a routine in place will help the caregiver handle what can be a very challenging situation. Reinforcement of treatment and routine from the caregiver is absolute key to the successful treatment of the heart failure patients. Thank you.
No, thank you for all that you're doing, and thank you for saying about having that checklist of everything, and the fact that you have them come to the visits and that you're really including them. So that's great. The last question is really to everybody, and I'm going to start with Giselle. We know the importance of good communication with our healthcare team, and you want to get the most out of one's visit. Knowing what questions to ask and understanding what your health care provider is saying can help you feel reassured that you're getting the best care possible. What are some tips for our patients who are on today on communicating with their advanced heart failure team, Giselle?
Thank you. I cannot stress enough the importance of knowing your symptoms and feel comfortable contacting us as soon as the symptom starts. We want to hear from you. We want to hear about your symptoms, no matter how simple of a change it is. More often than not, heart failure exacerbation symptoms are gradual, so we really want to hear from you about any changes in your symptoms. We want to know how you're doing. Not only that it'll prevent your rehospitalization, but it also gives us peace of mind on how well you're managing your health.
That's great. Nikki?
At every visit, I give my patients card with our provider's name and phone number on it. And I think this is a good way for the patients to be able to reach us at any time if they have any questions. And I also encourage them to put our number, because it is a direct line to our office right in their phone at the moment. And when patients come in to see us, I always encourage them to bring in the information of their primary care providers, their endocrinologists, or anyone on their healthcare team, just so that we can close the loop and we can stay in constant communication about the patient's care.
I love that. It's great. Bring a card. Kim, what would you say?
I would recommend for patients to be honest. Don't be afraid to tell your healthcare provider that you forgot to take your medication or you didn't follow the recommended diet. Your treatment regimen is adjusted based on what your provider knows. So be honest and never be ashamed to share what's going on.
Thank you. That's great advice. Jen, what would you say?
Sure. So I have 3 quick tips. One is ask away. We love your questions and we really want to engage in a partnership with you. We are better together. Always come prepared. Make a list of your questions before your appointment. So that way we can make sure that we address all of your concerns and questions together. And lastly, always at the very minimum, as we said before, bring your list of medications. But if you can bring the actual bottles with you, that's always helpful too, because then we can actually see what you're taking and whether that is actually on the list.
That's
Thank
great.
you.
You heard Jen saying, ask away. They love questions. Lena, what would you say?
Because medications are so crucial, communicating about medication availability, cost, how patient tolerates the medication, insurance compliance of medication is so important to provide support for the caregiver so that they can keep their loved one out of the hospital.
Great advice, great tip. So we really want to thank you. We're going to, in closing, thank you all for joining us. We hope that the information shared today has provided you with a better understanding of your condition. Remember, if you have any additional questions, to follow up with your healthcare team. Together, you will find a way to manage your heart failure symptoms and empower you to make successful lifestyle changes to better manage your condition. Thank you for joining us, and I hope that you all have a very happy Valentine's Day. Thank you.